Hi, welcome to Summit County Connection. I'm Steve Procyse with Summit County Public Health.
And I'm Elizabeth Edgar with the Summit School District. And we are here today to talk to you about how to help keep kids at school and safe this year.
And from the public health perspective, we're going to be talking about contact tracing, symptoms, and a few other frequently asked questions.
So again, my name's Elizabeth. I work with the school district as the mental and physical health coordinator. I will be working with our school nurses. We have a school nurse dedicated to helping to work on contact tracing and keeping kids in school as much as we can. Just want to remind folks that it's going to really be a partnership between the school district and families to keep kids safe this year. So parents, please, if your kids are not feeling well, please keep them home. Please communicate with the school about what symptoms they have and know that we are trying our best to keep everybody safe. Also, if you can remind your kids and make sure they have their masks with them when they're headed out the door in the morning, that would be great. We are really looking forward to seeing your kids at school this year. I'm going to pass it over to Steve, who's going to give some more information from a public health perspective.
Okay, so we're going to start off with one of the biggest questions we get frequently, and that is, what is isolation, what is quarantine? I'm going to go into this pretty quickly. So isolation's for someone that is symptomatic or is a confirmed COVID positive. This is a 10-day period of isolation from symptom onset, so when the person becomes ill. And a quarantine is a 14-day period, and that's for an individual that has come in contact with someone that's COVID positive or probable. That 14-day period is specifically because of that contact. The person could be incubating the illness for 14 days and may not get sick till that 14th day. Now we're going to go into just a few frequently asked questions that we've got. So what symptoms should you be looking for in your child or yourself for COVID-19? It's quite a long list, but I'm going to go through it real quick. Fever or chills, cough, shortness of breath or difficulty breathing, fatigue, muscle or body aches, headache, new loss of taste or smell, sore throat, congestion or runny nose, nausea, vomiting, or diarrhea. These symptoms are routinely updated on the CDC's website, and we should be able to get that for you on the bottom of the screen here. Next question is, what do I do if my child has symptoms consistent with COVID-19? Now, this is one that Elizabeth touched on. We really want to make sure that people are keeping their children home from school if they have any of these symptoms listed. And then also, we recommend that you get your child tested if they do have any of these symptoms. And those, the most recent testing sites will be located on our Summit County website. Another frequently asked question is, how long should my child stay home if they have symptoms of COVID-19? So as we discussed earlier, if they're symptomatic, we have that 10-day period, and you'll be contacted by the Summit County Public Health Department in conjunction with the school district to discuss that time frame. What if your child has close contact with a probable case or confirmed COVID-19 case? Summit County Public Health will work with the school district to notify everyone within that cohort or class. And then everyone will be asked to quarantine for 14 days from the last exposure from that COVID-19 exposure. As far as how our contact tracing will work during that process is, again, we'll send out that exposure letter in conjunction with the school district. We'll have some dedicated staff to work on that with public health. And then from that point, anyone that's a close contact of the COVID-19 case or probable will get a phone call directly from our public health staff to discuss further. And I believe that's all I had for frequently asked questions at this time.
And we realize that this is a lot of information and can feel really overwhelming and confusing to parents. So just know that school district will have dedicated staff working on this. We will be working really closely with public health so we can help you navigate that should your student become sick, should your student's class or cohort need to be out of school for a while. It is really everyone's goal to keep your kids at school. We want to keep students safe. We want to keep staff safe. We're really excited to have everybody back. So we're really hoping that we can all work together to do a really good job this year. Part of that will be keeping your kids and your family safe when you're not at school. So just as a reminder, when you're not at school or your kids are not at school, just to continue to practice those practices that you've heard a lot about. You know, meet outside when you can, try to keep group sizes to 10 people or less, stand 6 feet apart, wear your masks when you can. This really is going to be a community effort.